Massaging your total hip replacement scar should be an essential part of rehab, but not all patients are reminded to do this. This scar you can see here is about 4 or 5 weeks post-op, and really you should only start massaging a scar once it has completely dried out, sealed fully, and it should be around the same time you're allowed to do water-based exercises, which are the same indications really when it's dried out. And there's not going to be any chance of infection into any open bits. Essentially, to use a non-technical word, massaging the scar is very good for getting rid of the bumpiness, and also massaging any scar tissue which exists under the scar as well. As stated on screen, to get the best results, you should really start doing this 1 to 3 times every day and do it for about 2 to 5 minutes. Your recommendations will probably be to massage it for 10 or 15 minutes, but actually if you do it for less, for 2 to 5 minutes, it's a very long time anyway, and you'll get good results from that as well. As in the video, just put moisturising cream. Any sort of moisturising cream will do, as long as your fingers can glide over it and it avoids friction with the scar, and just go in circular motions up and down over the scar and either side of it. The pressure, of course, you can decide. If it's very sensitive, you just want to start off with very light touch only, and that will get the scar used to being touched and should dampen down the sensitivity of it after a few days to a week. And then you can start applying more pressure, and that will help, as I said, sort of improve the cosmetic appearance of it and get rid of any sort of scar tissue which exists underneath the scar as well as on the surface.